Up next on Primary Care, lupus. Black women are at higher risk and suffer more life-threatening complications than their white peers.
They generally have more severe disease. It occurs at a younger age. They have major organ involvement.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, where each week we address issues and conditions related to the health and care of African Americans. It is estimated that 1.5 million people in the United States have some form of lupus, an autoimmune disease that causes symptoms like fatigue, fever, rashes, and joint pain. It can lead to serious organ damage and occurs more often in women than men. African American women are more than 3 times more likely to get lupus than Caucasian women and suffer more life-threatening complications. Joining me to talk more about lupus is Dr. Josephine Dhar, who is a rheumatologist at Ascension St. John Hospital, where she specializes in treating lupus and in lupus research. She is currently developing an academic rheumatology program in Metro Detroit and building a joint Wayne State Ascension Health lupus research program. Dr. Dhar, welcome to the show.
Thank
so
you.
Glad you made it today
Thank
to join us.
My pleasure.
Lupus, a lot of people have lupus. It's one of those disease states that seem to come at you and all of a sudden you say, oh boy, my patient also has lupus in addition to other things. Why is this disease seem to be gaining in prevalence?
Well, I think people are becoming more aware of it, and it's increased in urban areas. It's also increased in women of color. In the Detroit area, we did a study and showed that there's a very high incidence of lupus in African American women. They generally have more severe disease. It occurs at a younger age. They have major organ involvement, like kidney involvement. And so for them, it is a more dangerous disease to get diagnosed with, and the treatment is also very hard sometimes. So what we've tried to do through our education is to make primary care doctors and the community aware of the signs and symptoms of lupus, because it can take sometimes several years to diagnose it.
Diagnosis, yes.
Because the symptoms are vague.
Right.
I don't feel good, I have joint pain, I have a rash, and just bringing the awareness to think about it. Now the primary care doctors are starting to think about it and order the testing for it and then referring them to the rheumatologist. So with time, I think awareness has improved and education has helped everybody sort of think of it earlier on in the patient's course.
What are the different types of lupus?
So lupus is a spectrum of disease. I don't really think of it as different types. Some patients have mild disease with just skin involvement, and some patients have very severe disease with multi-organ involvement. So when you see a patient with lupus, one of the things that I do is I sort of stage them. Where is the lupus? What organ system does it involve? It's different in everyone. You'll meet some patients that are doing fine with it and just have some rashes, and other patients who are extremely sick and in the hospital all the time. And then those patients tend to have a lot of side effects from the treatment, as well as organ damage from lupus.
Pat, why is it classified as an autoimmune disease?
So autoimmune disease means that your immune system's gone a little crazy and it's attacking yourself. Normally, our immune system fights off foreign invaders, bacteria, viruses we get exposed to. And in patients with autoimmune disease, your immune system doesn't function properly and it starts attacking your own body for reasons that we are not really sure why.
So basically, we need to be more aware as primary care providers and look for the disease state itself. So how do we do that? How would we recommend that primary care physicians test for this disease?
Well, this disease is a disease of women of childbearing age. Mm-hmm. So you look for the demographics and think of patients that might be having rashes or getting rashes in the sun, losing their hair, having joint pain, not feeling good. There's a lot of systemic signs, or if they start having low platelet counts or inflammation around the heart. Sometimes these patients are diagnosed as immune thrombocytopenia, which is a low platelet count, and what they really have is lupus causing that. but no one's thought of that. And then sometimes they'll come to me from the hematologist. So what you can do to help the patient as a primary care, in addition to referring them to rheumatology, because we always like to see these patients, is lifestyle is very important. Stress can make the disease worse. Avoiding sunlight, so decrease stress, avoid sunlight, eat healthy, no drinking, no smoking. Make sure that they get their vaccines, right? Because they're susceptible to infections, so they should be vaccinated for all the standard of care vaccines that we have for immunosuppressed patients. Making sure they get an eye exam every year because they can have all kinds of eye problems. Making sure they see the gynecologist every year and getting a pap smear because they're higher risk for cervical cancer and cervical neoplasia. Things like that, you know, what I do is I sort of teach my patients to take care of themselves. So when I left to work at another medical school for a short time, my patients knew the routine, and when I came back, they were like, you know, I did this, I did that, I'm up to date, and I was really proud of them. So part of it is teaching the patient to take care of themselves so that they can carry this on whether you're there or not. They know how to take care of themselves, and they know what to ask their doctor for.
Is there a hereditary component?
So lupus, it's very complicated. There's multiple genes that contribute to lupus. It's not a one gene disease. That's what makes it very complicated. And this gene, multi-gene influence is also different in different ethnic groups. So it's not a uniform genetic deficiency that's causing it. There's a genome-wide association study where they are looking at different diseases, and the heritability of lupus nephritis is about 47%. And sometimes there's families that have other autoimmune diseases. And so you may be related to someone that has lupus, but maybe you have rheumatoid arthritis. Or maybe your other relative has a positive ANA test but nothing else. So it doesn't all come as a one gene thing. There's multiple genes that contribute to it, and then maybe there's a trigger in the environment that sets it off. We don't know.
And with varying stages of presentation, I'm sure that complicates the whole discussion about whether there is a hereditary component.
Yeah.
It can be difficult.
It can be difficult, but if they get into the rheumatologist early enough, they'll get staged properly and they'll get the treatment we need. The treatment is also difficult at times because what we do is we knock the immune system down so it stops attacking your body. And what happens when we do that, it makes you susceptible to a lot of infections. So patients can get very bad infections while we're trying to treat. If you don't treat, you can still get infections because your immune system doesn't work properly, and then you'll get organ damage from the lupus. So you have to treat, and then you just have to treat the infections as they come along.
How do patients, in your experience, accept this disease once they're diagnosed, in particularly females and African American females?
I think it's harder for young people, and the younger they are, the harder it is, because when you're young, you want to have fun, you want to do what other young people are doing, and when you have young individuals getting lupus, it's very hard for them. They want to do what their friends are doing. So it takes a while to get them to the place where you have to tell them, you're not going to be healthy. If you do this with your friends, you're going to end up in the hospital. They're not going to end up in the hospital. And you have to sort of grow with them. You have to help them grow into it. We certainly now have much better support groups and organizations, especially in the Detroit metro area. Shannon Hester runs lupusdetroit.org, and she's very active in working with the Detroit area women with lupus, particularly the ones that don't have good financial means and that don't have good family support. In any chronic illness, family support is very, very important. And it's very hard to try to take care of these patients because they can't remember their medication, they can't remember all the complicated things they have to do. And then they have nobody with them, and they miss appointments, and they sometimes don't take their medicine right and end up in the hospital. So when I have a supportive family around the patient that has lupus, that makes a lot of difference in the outcome and how well they're going to do.
So like a lot of other disease states, lupus is no exception when it comes to all the social aspects that are brought to the table in the discussion with a patient that has to face these walking back out the door.
I mean, I've had patients that have been homeless that are trying to take care of their disease. I've had patients that have dysfunctional families where you almost have to try to save the patient from the environment in some ways, and it's just very heartbreaking. I've always wanted to build a program in the Detroit area where we have some support for these women. Because if you don't have resources, you don't have a car, you don't have a supportive family, how are you going to go to all your appointments? How are you going to take care of yourself? You can give advice, but if a patient doesn't have resources, how are they going to do it? You know, it's easy if you have resources. It's very difficult if you don't have any resources.
Like in most disease states. We're going to take a quick break. Coming up next, you'll meet a vibrant young woman who was diagnosed with lupus at the age of 23.
How has lupus changed your life? What does lupus feel like?
It's a cruel mystery.
We need to find answers.
We need to find a cure.
We need more people involved.
We need to know lupus.
I hope that there's a cure.
To learn how you can help, go to lupus.org/know.
Shannon's world was completely changed when she received her lupus diagnosis. She had just graduated from college and feared her future.
When I was diagnosed with lupus, I was shocked and I was also scared. I knew one other person who had lupus, and whenever I saw her, she had to have people assist her with walking. She was always in pain, and so I thought that was going to be my story with the diagnosis of lupus. I had just graduated with a degree a month before, and so I had plans on continuing my education, going to grad school, starting my career, going out and doing job interviews, and because of the diagnosis, I was no longer able to do that. So that was definitely a shock for me. I had to mentally prepare myself that this is going to be my new normal. And it was something that, quite honestly, in the beginning, it was a challenge to adjust to, because I figured, here I am, I'm 23 years old, I got my degree, I'm young, I'm going out here, I want to start my career, and I'm not able to do so. Lupus changed my life by making me dependent on other people. And I'm one that's very independent. And so by me having lupus, the most tasks that people may take for granted, such as putting on your clothes, taking a shower, really going to the restroom, to be quite personal, I needed assistance with that. So that was definitely a life-changing moment for me, because I'm dependent on someone else to provide my most basic needs that I should be able, and people are able to do for themselves, I can't do. I get swollen joints, my limbs get swollen, so I'm unable to bend or move my hands, things of that sort. And then it also makes you extremely fatigued. So I can sleep for 8 to 10 hours, and then I'll wake up and I'll still be just as tired as if I didn't get any sleep. So it's an ongoing thing where it constantly saps your energy and your strength. I am being treated by a phenomenal rheumatologist by the name of Dr. Dhar. She has really been able to monitor my medications by me going to my doctor's appointments regularly. She stays on top of how I'm feeling, how I'm reacting to the medications. I also have a fabulous support system that have really been there with me. My mother, who's my caregiver, she has literally been there every step of the way with me, caring for me, supporting me when I feel great, when I feel not so great, when I want to vent and say I'm tired. I'm tired of this disease, I'm tired of feeling this way. So definitely having that support system there to just listen, not necessarily adding anything to it. Just needing someone to listen and just saying, I'm here for you, that has definitely been a great benefit for me.
Dr. Dhar, Pat, this is so typical of what we hear and see in a clinical setting. Shannon was devastated with the diagnosis of lupus at a young age of 23. Why are younger African American women at such higher risk with this disease?
We don't know. It seems to attack women in their childbearing years, particularly African American women. And that's the years of their life that they want to be productive, and they're getting their education, they're starting families, they're thinking of children. These are all things that lupus can interfere with. And so a lot of these women get depression. And when you're depressed, you also can't take care of yourself. It is very, very important to have family support, because sometimes you can't drag yourself out of depression. You can't see the end of the tunnel, especially if you are not feeling well and you're getting a lot of treatment with side effects. So unfortunately, this is the biggest demographic of the disease is women of childbearing age. We don't want to leave the men out too. Young men get lupus, and when they get it really bad. They get it in the kidneys usually.
It seems to be a different disease almost.
Well, it's more severe, and they have a higher incidence of renal involvement. So 90% of the patients with lupus are women and 10% are men. And the men usually have more severe disease. So men, as we know, probably don't take care of themselves as they should. And so a lot of times it's hard to treat them as well, because when you're a man, you're expected to, take care of things, take care of your family. You're expected to be the, breadwinner, in a lot of families. And when you can't do that, it's very difficult for them to accept. So depression is a major problem in patients with lupus.
And should not be overlooked.
And should not be overlooked. I mean, sometimes you have to just encourage them and then make sure the family cocoons them. But imagine being sick and being depressed and not seeing the light at the end of the tunnel and being alone, or being a single parent to 4 children and having no support. Imagine how you would do that. Almost impossible.
For years people would say, boy, pregnancy either makes a disease state go away or it brings a disease state out. Speak to us a little bit about pregnancy and lupus.
So pregnancy is something that is not good in lupus. When you have active lupus and you become pregnant, it can make the disease worse. And then when you have the mother being sick, the baby doesn't grow. And so these women can have miscarriages, stillbirths. So we try to counsel them that wait until your disease is quiet for 6 months and then try to conceive. If you try to conceive when your disease is active or you're on the wrong drugs, it may be a roller coaster ride. If women do get pregnant, whether they're active or not, we try to help them through with the pregnancy. Sometimes the outcome is good, and sometimes it's very tragic. So the more you can encourage them to plan their pregnancy and not kind of just stop taking their meds and get pregnant, you'll have a better chance at a good outcome. So once you control the disease, women can actually go ahead and have children. In the old days, they used to say, tie your tubes and this thing and that thing. But now, if you can get them through the dangerous period and treat the disease and quiet it down and plan the pregnancy, you can have successful pregnancies in women with lupus.
From a counseling standpoint of view, that becomes very important. You touched earlier on lupus and the kidney in men, where it seems to be a more devastating disease or a worse disease. Talk to us about other organ systems. I think I've seen lupus in a few places.
Yes.
It's like a vagus nerve wandering around sometime,
So it can actually affect any organ. It can affect the brain and cause strokes, and then women will lose the ability to do things. They lose cognitive function. They can have bleeding in the brain, or they can have inflammation in the brain, and that can destroy brain tissue. So every time you have inflammation, you lose a little organ function. And in the old days, we used to treat and then back off on the meds, and they would flare, lose organ function, then treat. So now what we do is we treat and keep them on maintenance for a long time so they don't have this, up and down flare and then quiescence. It can occur in the heart, it can occur in the lung, it can cause heart failure, it can cause inflammation around the heart, it can occur in the GI tract and cause vasculitis. It can occur in the kidneys and cause kidney failure. Patients can go on dialysis, but they are very good transplant candidates. It can occur in almost any organ system, the joints, the skin. When it occurs in a major visceral organ like the brain or the kidneys, that's when you have long-lasting, devastating effects that might affect the patient's ability to do things that they want to do in life.
Expand on the HPV, cervical cancer, lupus situation for African American females, because that's very important.
So African American women bear two burdens. One is they have higher mortality from cervical cancer and higher prevalence of it. And they also have a higher prevalence of lupus. Women with lupus, and we've shown that, are higher risk for cervical cancer and precancer lesions, and they're also higher risk for HPV infections. So HPV, or human papillomavirus, is a virus that you get. Most people are exposed to that. It's sexually transmitted. And how you get rid of it is your immune system gets rid of it. And sometimes it can stay around for 2 years. So if you don't have a good immune system, it'll stay in your cervix and it'll build a home there. So the risk for cancer is really related to how long it stays in your home. If it's there for a long time, it's going to start turning into cancer. The vaccine is the best preventive medicine that we have now for preventing HPV infection, because what that does is it gives you an army at the gates so that it can't set up house there. That's the best way to prevent it, is to prevent HPV from setting up house. And we've completed a vaccine study, Gardasil vaccine in women with lupus, and showed that it was safe and immunogenic. So I really believe that the HPV vaccine should be part of a woman's healthcare program. Nobody thinks about it because the HPV vaccine has a lot of bad connotations, but think of it as an anti-cancer vaccine. So one of the things I'm very passionate about is making sure women are vaccinated, not just for pneumonia and the flu shot, but also for HPV. We're actually, that's actually my area of research, and we're actually putting together a study in the Detroit area to look at the biology of HPV in African American women with lupus, and then we're going to try, if we can, to offer the vaccine to them free of charge as part of the study, so that we're doing something to improve their health. So I don't know if I'll be successful in that, but I'm working very hard to try to get it going.
This has been outstanding. For such a disease state that we still see so many people, in particular African American females, suffer from, we're hoping that we can do a better job in the future. Speaking of the future, what's coming down the pike? What can we expect? Is there any exciting drugs in development, or any new testing that's coming that we can get geeked up about in terms of doing a better job in diagnosing and treating lupus?
So they're looking at genetics. That's going to be ongoing, but again, it's very complicated. They're trying to understand why this autoimmune develops, what triggers it. There's a lot of work going there. The real science will be if you could identify the pre-disease state, if you could identify women that were destined to get lupus but didn't have it yet, and then somehow alter the course of the disease so that they didn't get it. That would be where you would really make an impact. Because once you get lupus, in some way or shape or form, it's a chronic disease, it's not curable, and then you have organ damage. If you could prevent the disease when you identify a pre-disease state, I think maybe in 10 years we'll figure out how to do that. Also, we're doing a lot of genetic testing to see, are there some patients that will respond better to one drug or the other? When you're doing clinical trials, there are some patients that respond really well to a drug with lupus and some that don't. And there may be different genetic reasons for that. And so and when they do these drug studies, they are looking at the genetics, and I think the science is going to be able to say, well, you are person A with lupus, here's your genotype, you're going to respond best to this drug. And so instead of trying A, B, and C first, we'll go straight to this drug because we know that's going to work with your genotype. So I think that's where the science is going. There's a lot of new drugs in development for lupus. The first drug that was actually developed for lupus was belimumab. So prior to that, we were borrowing drugs from oncology and then using them in lupus, and that was actually the first drug that was actually developed. So it made got a lot of attention, but still, for really bad kidney disease, we don't have good treatment. We have very few treatments. The treatments have kind of plateaued. Belimumab is not really good for acute, really bad disease. It's more of a maintenance drug. So we, for really bad disease, we have Rituxan, IV Cytoxan, and Cellcept, and we don't really have other good drugs for heavy induction. Maybe in 10 years.
Pat, your passion for this certainly comes through. We're so glad that you decided to continue this battle in the Detroit area. Thank you so much for joining us on the show. We'll do
My
this
pleasure.
again.
Thank you for having
Excellent.
me and
Thank
giving
you.
me a
Good
chance
see
to
you.
talk
Good.
about it.
Excellent.
Appreciate it.
Our guest has been Dr. Josephine Dhar, rheumatologist at Ascension St. John's Hospital here in Detroit. African American and Hispanics are more likely to die from lupus, which makes early diagnosis critical to receiving appropriate treatment. Because lupus symptoms are often misdiagnosed, African American men and women, but especially women, need to be more aware of the signs and symptoms of lupus so they can prepare and be empowered and ask doctors to check for this important disease. For Primary Care, I'm Dr. Lonnie Joe. Thank you for joining us.